Doc, good morning, and we're here with another discussion, a session with the COVID-19, the vaccines, and all that. We've been doing this session for a couple of months now, and every time we're here, Doc, things keep changing.
Absolutely correct. The data is changing. Better stuff are coming out, new medicine, and numbers keep going up and down. Yeah, lots of things are changing around. Not only in your country, in the federation, Weber, but worldwide, we're seeing lots of changes.
And that is one of the things that we discussed and highlighted over the past months, that it continues to change, mutate, and so we, in our responses, we have to, adjust accordingly.
Absolutely correct. Absolutely correct. Some of the data is coming out of the U.S. is that even though numbers are climbing in terms of hospitalizations and everything, what they're showing now, which is recent data, is that the D variant is decreasing the effectiveness, and people who've been admitted or making the diagnosis with the D variant has decreased considerable. So there is a turn that is occurring, even though we're still seeing some high admissions. The D variant seems to be weakening and decreasing in the U.S. per se. The Caribbean is showing a little bit different data. But if we look at the trend that's been going on worldwide, is that we always follow behind, and that's what we're seeing now. We're getting our spikes, and then hopefully it will decrease, and we can move on.
Now, Doc, it is, I had said in a discussion in a different forum a couple of weeks ago that it seems to me that, having discussed at length the pros and the cons of the vaccine and so on and so forth. Some people say that they're conspiracy theories and so on and so forth. Are you satisfied, generally speaking, Doc, that most people have been educated on the vaccine?
Weber, and that's a very appropriate question. Question. I have been looking at the data and the response to people to the education that we've been putting out there. And as I say, I do this for many countries, not only St. Kitts and Nevis. I've done Anguilla, Tortola, Antigua, Barbuda, and I've even gone as far as to the diaspora of New York City, and I've spoken a lot about the disease. The information is getting out there. It is being clouded by the misinformation, and I see they're making some steps now to stop some of the misinformation that's out there. The people, for some reason, are not having confidence in their doctors, who they should be and who they were having confidence in the past. Also, some of the data that is out there, they are questioning the data and whether or not the government is giving them the right information. But for me personally, and for all the years I've known myself, and for the government and for the people, is that the data that they do put out is more than likely substantially correct. I don't see that there is any reason to say something untoward, something contradictory, or something that's bad when people's life is at stake. When we're looking at something like public health again, and that's a very important word, public health, in terms of that, the effect of what we do affecting each and every individual in the public, we have to, as a government and as the physicians, put out the truthful information, because it does impact the lives. And I saw an article from one of the doctors putting out that the people think that the doctors are giving them bad information, when we are the same ones who are out for trying to treat the disease, being exposed, and then we still have to go home to our family and friends. I think that cleaning up after bad information is worse than just giving the good information and trying to get a handle on it. And I'm saying that to say, Weber, in that, yes, the education is going out, but people are still having doubts. But what's leading the way, Weber, and what is we have to look at is the data from your country is what I think is going to do to change the minds of a lot of people. And I'm quite comfortable, and I keep telling myself so that I really don't need to be out there talking anymore when the data is just unremarkably saying to us that the vaccines are helping, it's doing its job. Majority of the people who are dying, who are in the ICU, are the unvaccinated people. Now, and when I say that, Weber, I think that that's where it's going to boil down to. People have the choice to decide. Mandation is not the way to go, but people need to understand that if they are sick or they have the potential to get sick, it affects the whole public and the public health. And so the government has to decide what they're going to do in terms of changing or helping the situation if you as an individual are going to affect the lives of everybody else. Something needs to be done. Something needs to be mandated. The fact that these vaccines been mandated all our lifetime is also an important thing that we need to understand. Mumps, measles, rubella, polio, all of these were mandated because these diseases were doing the same thing that COVID is doing, and nothing has changed dramatically. So the data and the fact that people are dying from this disease, and the fact that we're seeing more and more the unvaccinated are the ones who are in the hospital, who are occupying the ICU bed, and the ones who are dying, is what I think is going to be the biggest impact to change people's mind. There are no deleterious effects or no bad side effects to the vaccines. Nothing has been proven so far to have manifested itself after the vaccines are there. And if it is very limited, very small. Nobody's very negligent or negligible in terms of side effects profile from this vaccine. Again, I say to people all along that people will tell you this has happened, that has happened. I know one person, I know two. But if the world has had 6.4 billion people vaccinated, okay, and in your country, I think they say it's about, I think it's about 22,000 people, 23,000 people who have been fully vaccinated, Weber. And out of those, if someone had died in that 23,000 that's fully vaccinated, I'm sure, Weber, you would have been in contact on knowing one or two of those persons. Or if someone who have had really bad side effects, you would have known at least 10 of those people in that 23,000 in your population base that you would have been in contact with. But we're not seeing that. We're hearing of here and no documentation of any one of those side effects. So that's there. When we look at places like Israel, who has about 88 to 90% of the people fully vaccinated, and of that 12% that is unvaccinated, 76% of those people are in the ICU. Listen to the numbers that I'm giving you. 76% of 12% are the ones that are in there. And these are the unvaccinated. St. Lucia placed out some data again and again. I'm not against anyone who have decided they don't want to vaccinate it. I just need them to just look at the data. You don't need to be calling me to educate people when the numbers are strikingly out there. There is nothing wrong with the numbers that they're putting out. In Antigua last week, they had 17, in the month of September, we had 17 deaths. Last week, 6 persons died from COVID disease. About 3 or 4 of them were 25-year-old, 27, 28-year-old people who are not anti-vax, but they're they are against getting the vaccine. And these people were healthy persons running around active, saying they're going to be immunoboosted. And when the disease hit those couple of people, instead of coming forth and saying, hey, I have the disease, they stay in the background, hide, and then they end up dying because they get to the hospital and it's too late. So out of those six, Weber, none of those people were fully vaccinated. We had 2 more deaths last night into this morning, and none of those, and we're now in Antigua putting on there unvaccinated. In Antigua right now, we have to set up another morgue on the outside, a cool container to put people who are dying because the funeral homes have too many people. They can't hold the people that are backing up now to be buried because of the COVID disease. This is where we're heading to in this state of affairs, and these are unvaccinated. I could tell you this, and I know in Nevis that the operating room and everything is closed down, only emergencies. The same situation in Antigua. And now what we are finding is happening is that the people who are pregnant who want to be delivered can't get into the hospital because we have 56 people in the hospital who have COVID disease, and of those 56 people, all of them are unvaccinated. And so when you are impacting the life of each individual, Weber, it becomes a problem. I cannot operate on a guy who has cancer disease because I cannot go to the hospital because it's COVID disease. And when we look at the data, again, they could tell me I'm lying, or you could criticize. I am saying to you, when I look at the data, when they tell me who is at the hospital, it is the unvaccinated people who are blocking the areas for people who need to have babies to go to deliver. When you have these kind of things happening, you have to talk to your government, and your government has to do the right thing in the best interest of the people. Right now, Antigua has mandated the vaccines, and we are now 42,000 people. The other day we could not get out of 35, 36,000 a week ago, 2 weeks ago. Now we're 42% fully, 42,000 people fully vaccinated. We're 41.7% vaccinated, and we're trying, the numbers are going up. The mandate starts on October 1st, which I think is going to come up on Monday. And so all the centers are now filled with people who run. There is no need for us to be mandating anything when the data is strikingly telling us this is what's happening. People look at what's happening, and this is what's going down. There is no contraindications to the vaccines. There is no need for Weber to call me this morning and for me to sit on this program and talk anymore, Weber. And that's my point I'm trying to make. Because the data is strikingly out there. 6.4 billion people have been vaccinated. 2.4 or 3 billion have been fully vaccinated. Whatever they're telling you is happening is not happening, and predicting the future, they have no basis or no dogma, no data to tell you that these things that they predict is going to happen. Control of people's mind, the change of genetics, the what they call it, the immune escape, all of these theories, conspiracy theory, has no future because there is no history of this happening before. But we, the people of the world and of this country, have data that shows that vaccination has worked and has eliminated a number of pandemics worldwide, and no side effects, no immune escape, no patient control, no body control, no mind control. None of those has ever happened before. And again, I keep saying to you, Weber, the vaccines have not changed from that dramatically from 1798 to 2021. Nothing has changed that dramatically in the vaccine. If for anything, we have gotten better with the vaccine. So I'm saying to you, Weber, education, we have spoken, we talk to the people. We would give all the information out there. But what I want people to do is for me to stop talking and for you to stop trying to convince them when they can look at the data itself and say, this is what's happening worldwide. Chile has 77% fully vaccinated. Spain, which was dying left, right, and center, is 77. Chile is 72% fully vaccinated, and these people are doing well. They open up. Montreal is open up. Ireland is open up. Denmark is open up because the people have adhered to their scientists and their doctors' advice, and they're doing what they are supposed to do. We are now entering the realms of vaccinating the kids. And remarkably, people are now hesitant to vaccinate the kids, when before it was mandated that if you're going to school, you have to be fully vaccinated. Again, I've said nothing has changed from since then to now. Why is it a problem to vaccinate the kids against COVID disease? And I'm having a little laughter because we have been doing this all our life. I think that we are probably 100% vaccinated when it comes to mumps, measles, and rubella in the Caribbean, because we vaccinate you as soon as you get out of the womb and you're a kid. You get your vaccine for the mumps, measles, rubella, polio, all of these typhoid, tetanus, all of these vaccines. And so if we keep doing that, can you imagine now where since 1953 they've been vaccinating against polio? So can you imagine? And all the kids worldwide have to get these vaccines. Very few might have missed it. So you can understand where we are now in terms of those diseases. We are 100% vaccinated. We're way past surpass herd immunity with those diseases. There have been countries where they stopped taking the vaccines for MMR, and the disease rose its head again and again and again and again. I can refer to those even in England, even in America, even in Pakistan, Kyrgyzstan. These things have happened before. Mandating the vaccine for kids has always been an entity. There is nothing at all wrong with doing it again, and there's nothing at all wrong with our vaccines. It is proven itself again and again and again. When you're ready, call me and tell me someone who you know in the Caribbean who have gotten the blood clot from the vaccine itself. The virus itself, catching the virus itself, you are more prone to developing blood clots than from the vaccine itself.
Doc, against the backdrop of portions of what you said in reference to, persons getting the education and getting the information, but not perhaps adhering to it, but perhaps go towards a conspiracy theory. Now, doesn't it expose to us the type of society that we have in terms of, persuading persons? And is it not true that for the most part our Caribbean people sometimes like to be coerced a little into doing things?
You are so right. And I always quote the great Bob Marley, in the abundance of water, the fool is definitely thirsty. And they try and find, you got water all around it, but you're looking for other things to do. And we get the ignorance of some of these, and not using the term derogatory, is that ignorance meaning not knowing, is what's killing a lot of us. And it also reflects, Weber, our level of education, and it reflects a lot of things which it's a concerning thing. It is really what you have just brought up is a very concerning thing, and we tend to listen to other things and pick up these conspiracy theories and don't really vet them. Don't look at at what it is. I've been criticized and I've been told that I'm being paid to go out and preach, to talk about vaccines, and that is so wrong. That's
an example, Doc, isn't it, of how the society is? Because every time somebody gives something and you cannot really bring the data or the evidence to debunk it, you say, "Oh, you've been paid." to do it.
You are so right. And that's what I'm saying. I've been criticized, and I've also been asked, who gave me the authority? Where did I do vaccinology? Did I do this? And I'm saying to you, look, every one of those aspects of it is part of my medical education. I have to do immunology. I have to do biochemistry. I have to do all of these things to get to where I am today, so that I have that ability. And I also swore an oath, the Hippocratic Oath, to protect and serve. And I practice preventative medicine. So I have all of the reasons to try and help. I don't want someone to come into my office with anything late stage. That's why I do prostate screening. Nobody complained when I've been out there preaching for people to come out and get their screening for prostate cancer. I am now vocally speaking out so that people can come in and prevent. What I don't want is for you to come in with late-stage prostate cancer and for you to come in with late-stage COVID disease where your lungs and you got to be on a ventilator. And I can't do nothing. I can tell you how to prevent you to get to that stage. And if I can do that, that's part of my treatment. I'm not being paid. Weber don't call me and offer me no money to come on the radio and do this. This is my obligation. This is my duty. And I do. I told somebody the other day, which they're criticizing my credentials. And I said, look, I have published many papers, and I have citations where people have read my papers and use it to put back in other papers. I've published many a textbooks chapters, and so I've been out there. But besides that, not to blow my horn, but just to show you that, I should or able to help guide and direct some people in the direction that is necessary to help them come over some of the fears. I'm not being paid, and the ignorance of some of these things that they come up with is really mind-boggling, Weber. There is a young Jamaican guy by the name of Raymond Ashcroft who is going worldwide speaking about vaccines, and he answers all the questions. And he went to school at Oxford. He has a PhD in immunology, and he is a board surgeon and a plastic surgeon, and he has everything that is necessary for him to speak on these matters. And I sent one of the talks to, I don't know if I've sent it to you, but I've sent it to a few people. And somebody called me back and said, oh, he's been paid to say these things. I'm saying, no, the man has an education. Nobody's paying him. They interviewed him and he spoke, and he's been hired to talk about COVID because he simplifies the matter and he gives you the information, and his answers make proper sense.
Doc, you made
all the contrary people saying all kind of things. Go ahead, Rebel.
You made a point a little earlier as well in reference to the doctors, and the fact that the folks are now questioning what the doctors are telling them in reference to the COVID and all that. Are you concerned that going forward it will pose a problem? Because people listen to their doctors before, and the confidence. Right. So are you concerned now that this event or this situation might erode that confidence going forward?
It's already eroded the confidence, Weber. The conspiracy theories, the things that people are saying of their doctor, but yet still, they come and see you for the other disease entity. It's just something that I don't understand, the concept of a block mind when it comes to COVID disease and things from all the information. But some people are still coming. I still have patients who come to see me who are vaccinated, and I still have patients who are unvaccinated. They come to see me for the different disease entities and everything. Their mindset change, and I still have a lot of people now who, when I prescribe my medication, they Google it and they say to me, it has this, it has this, it has that. Whereas before time, it never happened. People listen to what I'm saying. And so now I have to explain in more depth the reason why, risk benefits. It it is important that you do this. Those side effects are not, and so yes, but that has eroded confidence in the medical fraternity. One of the things that people are saying, though, and more so, it has eroded big confidence in the politicians because of the way how they have approached this disease entity and the things that they're doing. I must say, in St. Kitts Nevis, the government has kind of stepped away and left it to the CMO and the doctors to do most of the control, and they're listening to them. In other countries, the politicians are the one who are just taking this thing and running it half. Bad information. The physicians are not speaking out, and they're not giving the information to the patients as they should, and that becomes a problem. Yes, the confidence has eroded, and I think it's going to change medicine for the future. Whether it definitely will, it's an important point that you have brought up, because people are doing this thing. Maybe it might be the wonder. Once we get this under control, this might disappear. I am not sure it's going to go anywhere because of the matter of all this misinformation that's out there.
It also perhaps shows what makes people do certain things, because you also have noted that when they move two factors, and you can correct me as to whether or not I got it accurately, two factors had moved the needle, so to speak, in Antigua. One, the harsh reality of the deaths that has been happening, and number two, the fact that they were mandated. So those two instances have moved the needle in terms of people getting the vaccines.
Absolutely correct. Again, and which is why I'm saying to you, when we started out from on that premise of more education. And I must say, congrats to you and to Fawn Radio for giving all the necessary information that's out there, because people need to know. Yes, those two things in Antigua have moved the needle. We've noticed even a 5-10-fold increase in vaccinations. Presently. And again, when we're looking at what's happening with the data that's out there, it is really having people be wise and people open. There are lots of people who had some hesitance, lots of people who wanted to get the vaccines, who were looking at what's going on. And again, with all the misinformation, by right, should criticize and look at what you're going to be putting into your body, and not just depend on anything. Look at LeBron James just got his vaccine, and he said he did his research. So we are looking at data that's pushing the needle. People are dying. St. Lucia has the same problem. Grenada, only, Grenada is only like 12% or 20% fully vaccinated. It's a small number. And so people are dying. They're pulling up the hospitals. They are dying. Literally, life are being taken. When you have a disease entity that not only affects you, but because you carry the disease, you are killing people, you have to make harsh decisions. You start impacting the public health. So decisions have to be made when you are a carrier of the disease that kills people. Something has to be done. I was looking back historically at, I don't know if most people might remember the story of Typhoid Mary. And Typhoid Mary was one of the first persons who demonstrated contact tracing needed to be done. Because Typhoid Mary came from Mississippi or whatever, went up to New York City, and she worked in the kitchen. And the family that she worked with noticed the people were coming down with typhoid fever, they were dying, they were getting diarrhea, all the family members, 3, 4, 5, but they didn't know where the disease would come, because Typhoid Mary was an asymptomatic carrier of the disease. Asymptomatic. She didn't know she had the disease, she just had the disease there. But the other people who caught the disease, again, would die, would get diarrhea. They would die. And so they got rid of Typhoid Mary from one home. She went to another restaurant and she worked. and they realized the same thing was happening. She went to another family and she started working, and they realized Typhoid Mary, in her moving around, unvaccinated, carrying this disease because she's an asymptomatic carrier, was killing people. It became a matter of public health everywhere she went. So she went to this family and they realized the same thing. So they hired a private investigator, which is where your contact tracing becomes now. This is the first time we're looking at in history of contact tracing. And so Typhoid Mary, they got the investigator, private investigator, to follow her wherever she went to work. And they realized that everywhere she went, the disease was going across America, and it followed her. And finally, the investigator went to Typhoid Mary and said, "Hey, you are spreading disease." But she said, "I am not sick." Said, "But everywhere you go, people die. People die, literally." And so the investigator said to Typhoid Mary, "Well, we're going to test you." When they tested her, she was positive for typhoid, Salmonella typhi. And she was like, "But I am not sick." "Yes, but you are a carrier of the disease. And when you carry the disease from one place to the other, the people die. People die. You literally are killing people. It becomes a matter of public health." And typhoid disease was spread by hand, not washing properly and doing. And she was a chef. So they had to put her, like what we do now, in quarantine, and they had to get her vaccinated against the typhoid, Salmonella typhi. And actually, Salmonella typhi, that's one of the diseases that we have developed a DNA vaccine against, the vaccinia, and that's just DNA. That one goes into your cell and into your nucleus of your cell, and you have to develop the antibodies against that one. And that's a DNA virus. That's not even the RNA virus. But these ones were developed later on in life, and we are able to. So my point is that vaccines been around for a long, long time. Long time, and they've been effective and they work. If you get in the disease and you're spreading it around to people and other people are dying, you are impacting the civil liberty of each and every individual. And so tough decisions have to be made when that is happening, and the government needs to make decisions in terms of whether or not you're going to mandate. Again, look at the data, look at the countries that are doing horribly with the disease entity, and you will see that they have a low percentage of the population who are vaccinated. 12% in Grenada. Grenada is doing horrible. St. Lucia's number has increased to about 20%. They're doing horribly because they're not following the vaccination, the protocols that are necessary, and the vaccination, which is also very helpful in the disease entity.
Doc, against what you just said then, in terms of that carrier who was not sick at any time but kept spreading the disease, would you recommend, for instance, because it's happening now, the CMO here had just indicated a couple of days ago that folks in terms of the contact tracing, folks are not given the necessary information, so it's making the contact tracing difficult. Would you therefore recommend, Doc, that someone comes into your personal space, they're not wearing a mask or anything, would you recommend you ask them, are you vaccinated?
And, well, and I deal with this every day. It's such an appropriate question. I deal with this thing every single day. And people get offended when I ask them, when you come into my office, and I ask that question, Weber. And I do that for the reason why. And I'm not so much that it bothers me whether you're vaccinated or not. And they have doctors now who, if you're coming to their office, they mandate that you are vaccinated, or else you don't come to their office. Because again, as an individual, I have to go home to somebody. I have to go home to my family. I have kids. I have my daughter. I have to protect those people. And so, yes, it is quite okay that if someone is coming into your personal space, you ask that decision. Now, again, this is why they say to you, If you're amongst your family and everybody fully vaccinated, you could take off your mask. So therefore, if you're in a community or you're at a restaurant, sitting at a table with a couple of your friends, that question is quite appropriate to ask, because then you can either keep your mask on, Weber, or you can take it off. And so it's important that these things are done. So when people come to my office, I always ask the questions on my way in, but I always have to clarify it, Weber, because I have to say I'm not interested in your business or whether or not you're fully vaccinated. But it's easy for me to communicate with you. If you're fully vaccinated, I can ask you to take your mask on. I could take down my mask and we can have a discourse because we are fully vaccinated and we can protect each other from that.
By the way, let me just... Yeah, sorry, Doc. Let me just say here to the callers who want to participate, we can start accommodating you now. Call 869-469-1700. So we'll try to accommodate you. I noticed that some folks wanted to maybe start earlier. So we'll continue the discussion with the doc, but you can, when I recognize that you're calling, we'll try to accommodate you. 869-469-1700. Use that number. Yes, Doc, go ahead.
Yeah, no, so it's quite appropriate to ask that question, Weber, and we do. Again, and when mask mandates were coming out, we had the discussion about why wear the mask and how does it protect you. Maybe it's quite appropriate to go back to those things again, because that was before vaccine. I don't know if you remember before vaccines, it was like, okay, why are you wearing masks? If you notice, the people, the negative things were coming out against the mask then. People started an uproar, you don't need masks, this is that, this disease is that, it's the holy Armageddon, you don't need this, God will protect you and all this stuff when first mask came out. But then as soon as the vaccine came out, they switched from mask to vaccine. Notice, and these are people who don't mean no well for you and your family and for society. Look at what they did. They maneuvered from the mask situation to the situation of the vaccine. Now, again, and then for the people out there who are listening, let's look at the mask quickly again, because we had gone through this again with Weber, in that if you have the disease entity, because the disease likes the lungs and the epithelial tissues that lines the area in your mouth, throat, your lacrimal ducts, which is your eye glands and everything. All those epithelial cells have what we call an ACE inhibitor, where the spike protein attaches to that area. And so when you cough or laugh or you sneeze, those epithelial cells will deglove or denude, and you spit those out. They come out, and it's like droplets or whatever it is, and it flies. And what we notice, 6 feet apart, it doesn't fly that far, unless you're in a church situation where you're screaming or singing, or even a sneeze or cough. The diameter, the distance that travels is limited, and so 6 feet is quite fair enough. And incidentally, it's the same 6 feet we bury you on, Weber. So the disease doesn't spread much beyond 6 feet, and that's why we recommend that as our social distances. So if you're not wearing a mask, and these epithelial cells, because the virus has to live in a cell, and those cells that are shredded when you breathe or cough or sneeze will fly out. If you have on a mask, those droplet particles cannot pass through the mask, because the size of the pores within that area is very small, smaller than, these, they talk about nanoparticles. It's smaller than a nanoparticle can go through that area. And so the mask is very protected with these droplets, from the droplets from going out. That's if you have the disease. If you don't have the disease and you're in contact with someone with the disease, you wearing your mask prevents the disease from going to your mask and going into the areas that it likes to live in. So you have protection from both ways. One, from you spreading the disease if you have on your mask, and two, if you have on your mask, getting a droplet or something from someone that will give you the disease is is very small and actually non-existent if you are wearing your mask. And the same thing with hand sanitizer. Because we usually sneeze or we put our hands in our mouth or nose, it's good to just put on the sanitizer. Lysol has been out there for hundreds and hundreds of years, which has on the Lysol bottle effective against coronavirus, and that's the general coronavirus,
Okay,
and it is effective against it.
Yes, I'm going to take this call. Hello, could you go ahead, please?
Good morning. Good morning.
Yes,
Thanks
go
for
ahead.
accommodating me. Just a question. What is your thoughts on the swabbing of the two nostrils? Is it something necessary?
Okay. All right, thank you. Yes, Doc. Sorry about
Hi,
that.
Weber.
Yes.
Yeah, I think again, and what you're looking at viral load and how much disease you have, and what you want is a good sensitivity on your test. And so again, if you the more the merrier, the more sensitive your test is going to be. Swabbing both nostrils quickly, especially if you have high suspicion or if you are in contact with someone with a contact tracing and you need to be sure that you don't have a disease, it's quite appropriate to swab both noses. You can just swab one noses because the oral pharynx and everything comes up and it splits into two. There are some people, and initially when we first started out doing the testing back in the day, Weber, we would do a nostril and we'll do the back of the throat. We're getting further and further away. Initially, when we started doing the testing, you would have to go all the way back into the oral pharynx. Now, the tests are so sensitive, you just swab the nostrils, both nostrils. Again, I personally, and when I look at the data, it's neither here nor there. It is up to your technician. Me personally, I've done all the different variation of tests. I've done over 60 tests, Weber. I've been doing 2-3 tests a month, 4 or 5 months, and it's been over a year and months since I've been doing the 2-3 testing, especially for traveling and going to other places. And it has all changed. And all of this, some people do it this way, some people do it. I still think that we're getting maximum sensitivity with just the one nostril. But again, it's up to the person who's testing you, and it's also situation derived. If you are in contact and you need to be tested appropriately and rigorously to make sure you don't have the disease, yes, go ahead and get the two nostril tested. If it's just you're going for travel and you haven't had any contact or anything, again, your technician who's doing the testing will have to decide whether they want to do it. And then also it depends on the type of testing you're getting and and the sensitivity of the test that they're working with. If they're getting good results from just doing one nostril, why change it? Continue to do so. But people do it differently for different reasons and for different things. If you want a good study and you want to make sure that you're healthy, get the two nostrils. Some people do a mouth and a nostril test. So it's variable, Weber.
Doc, by the way, a reminder, call 469-869-4691-1700. Someone wanted to know, Doc, the name of the doctor you had made a reference to who was moving all around the world and giving...
Raymond Ashcroft.
Okay. All right. Yes. Hello, good day. You're on the air. Could you go ahead?
Hi, good morning, Weber. Good morning to Dr. Twaithes. Thank you for this invaluable information that you're departing to us. This is what we need, Weber. This is what we need. All the going online and the different things that are being transferred on our cell phones, this is what we need, is straight talk. Dr. Twaithes, it seems to me COVID has now even more than ever confirmed how much we need to get in touch with our own medical maintenance to know what is happening in our bodies. And so we need to and I think you made reference to it earlier, about talking to our doctors, getting on a personal level with our doctors. One of the things that has amazed me is, and you said it earlier, you came here with your program for the prostate. Nobody questioned it, and we lined up in our hundreds to do it. We're now questioning everything about this vaccine and what's going to maintain our lives and keep us healthy. So how can we get our people to understand that we need regular maintenance? Because what is happening is, it seems a lot of us now are becoming awakened to the fact that we have underlying issues that perhaps we didn't know before. And COVID is unleashing and unraveling and uncovering all of that for us. And we're not only battling with COVID, we're battling with issues that we had even before COVID coming online.
Okay.
Thank you.
All right, thank you. Okay, Doc.
And yes, and very nicely put, and thanks to that caller for really hitting it home for me in terms of the prostate screening, and now the COVID again. Weber is not paying me to do this, and so it's important. The lack of confidence in your physician and in the doctor plays a big part in some of these things. And again, for me, I don't know for the others. I swore an oath to protect and to serve, and and preventative medicine is what I don't want to be treating nobody who comes in with anything late stage. Late stage disease is just as bad. Prostate cancer is just as bad as late stage COVID disease, and people need to understand. And she brought up a very important fact of knowing your body, knowing what you're going around. And lots of people now are complaining when they get the COVID disease, and some people are dying quicker than others because of underlying conditions. And she brought up a very, very important point, Weber, with underlying disease, whether you have diabetes or high blood pressure, or people who are chronic smokers. And what we're finding more and more, those are the people who the disease take down quickly. And one of the points that is important, when you are sick with these underlying conditions, unknowing to you, and you get COVID disease, you do not have the reserve available to protect yourself against the disease. Because when that virus hits you, it multiplies so quickly. If you already have 50% of your lung capacity gone because you're a chronic smoker, then COVID takes up the other 25%. You only have 5% left behind. It's common sense and it's straightforward. If you are immunocompromised, the virus is going to multiply like crazy ahead of you before you can even get an ounce of that antibodies develop. Always remember the difference between an unvaccinated and a vaccinated person is time. Weber, time.
Time. Okay, Doc, let's get this again, Doc. Hello, good day, you're on the air. Hello, you're on the... Okay, I'm very sorry. I'm asking you all to be patient with us. Doc, I'm sorry. In the meantime, while I'm waiting for that caller, please try again and call back. Call 869-469-1700. I wanted to also ask you, Doc, since this COVID, everybody now knows about more about the immune system, right? We talk a lot about that. But the caller is back, so let's go to the caller. Hello, thank you. Could you go ahead?
Hi, good morning, Mr. Weber. Good morning, Dr. Twaithes. Question. Is there any other means of testing apart from the nose? Because I'm hoping to travel and trying not to travel at the same time due to the fact of the testing that I don't feel comfortable by being tested by the nose. So is there any other way of testing apart from by the nose altogether? I will listen up here.
Okay, thank you.
As I said before, if it's not the nose, the nostril, then it's the mouth. And some people don't like the nostril. Some people like the mouth, putting it into the back of your throat to just wiggle it around and take it back out. That's quite another way of testing. Initially, we were looking at antibody titers, but it doesn't give you what we call, if you have active disease, it's very difficult to look at with the antibodies, which is just a blood draw. And most people are not accepting that because you can't tell if the person had the disease in the past or do they really have the active disease presently, and that's what you're looking for, active disease. So you could do the blood draw, but it's not an acceptable test. You could do it through the mouth, that's acceptable, and you could do it through the nostril. Those are the three big areas that we use in terms of doing the testing. I know it's very difficult to do. My daughter, while she was traveling with me the other day, she had liked the antigen test because she would be the first person to run up and get the antigen test. But then when we were doing the PCR test where they had to go in the back of the throat, that's when she decided she wasn't going first again. So it was a very funny thing, and I looked at it and said, but yeah, a lot of people are not happy with doing the testing, and that has deterred a lot of people from traveling.
But Doc, doesn't it also come down to, for whatever reason, what is required or accepted, and
yes,
also in different locales, what is available?
Yes, and that is true, and what is necessary for you to travel from one place to the other. Again, the Caribbean does more PCR for whatever reason. We're stuck to the PCR, and most of the bigger countries now are looking more at the antigen test. And the antigen test, you just do a quick swing in the nostril, which is not bad at all for the antigen test. Just a quick swipe of the nostril, both nostrils, and you go. You don't have to go all the way in the back like when you do with the PCR. But you also be mindful that sensitivity drops down. Again, PCR is a lot more sensitive. As I was saying before, Weber, time is the difference between a vaccinated and an unvaccinated person. It takes 2 weeks to develop the antibodies, whether you do it naturally or whether you do it with the vaccine. So within that 2 weeks window, you can easily pick up the disease entity within that 2 weeks of the vaccine, or if you're not vaccinated, you will have the disease, and the disease will continue to grow inside of you and multiply until the 2 weeks when your body manufactures the antibody. And that's the difference between the two, and that's the time that you need. That's why you need a vaccine on board to protect you quickly than to have the virus develops in you for 2 weeks before you can protect yourself, whether or not you're immunoboost or not. If you immunoboost and take the vaccine, it still takes you 2 weeks. If you immunoboost and you get the vaccine, it still takes you, and you're not vaccinated, it still takes you 2 weeks to build the antibody. So the difference between a vaccinated person and non-vaccinated is 2 weeks.
Okay, Doc, so I wanted to highlight the immune system, because from this COVID came around, we've been talking a lot about the immune system and how it reacts and how it fights the virus and the status of your immune system and all that. So the question I have, Doc, is whether or not, how can a person tell of the efficacy, if you will, of their immune system? Is there a lab test or something by which you can measure it? How do I know that my immune system is in very good shape to fight off certain diseases?
Yes, I mean it's not, there is not a magic test out there which is going to tell you specifically if your immune system is strong or weak, or if you're immunoboost, if it's good. There is not. We know certain disease entities that deprive you of immune response, and there are certain people who do not respond appropriately. Each and every individual is responds differently with the immune system again and again. One of the things I always go back to is kids. When you're young, the kids who get sickly when they're young end up to be stronger persons because they've been exposed to many of disease, and so their body builds the same things we're talking about with COVID. memory cells, lymphocytes, B cells. So they're always with you. So when you grow up and you get the disease entity, your body has already had these antibodies and it responds. It's simple.
So when I hear someone argues, Doc, and say, I don't have to take the vaccine because I have a very strong immune system which can fight anything off.
Mm-hmm. Yeah, and that is so erroneous. It's not fights off anything. What immunoboosting does is really give you the vitamins, minerals to get your immune system ready to fight. But to build, you have to still build antibodies against a specific disease entity to have immunity against that specific disease, Weber. Again, let me repeat that because that's such an important point. You boost and everything, that's fine. Your antibody, your body is ready for if something attacks you. And these may be strong, you don't know until the disease hits you. When the disease hits you, right, your body has to now go and build those antibodies against that specific disease. So even if your immune boost is very global, it's very strong, but you have to have the disease and that disease will trigger your body, your strong immune system that you have to build antibodies, but it still takes 2 weeks, Weber. Again, time is so important. So regardless of whether you immune boost, you have all your vitamins and zinc and all that stuff, you still, most importantly, have to build these antibodies against that specific entity. So kids who get multiple disease build their antibodies, and those antibodies are there and they stick around and they wait for that virus, that specific, if that specific disease hits them, then they are protected. So people who don't get disease when they're small, when they get the disease when they're old, they have a horrible time in response and doing that because you don't have those antibodies on board. You have to go back and build them. The disease multiplying you and it destroys it, which is the same principle we are using again with the vaccines to help us. It's simple, Rebel. There's nothing changed. It's the same principle. So even if you are immune boost, simple. When the virus hits you, you have to take those boosted cells that you have, carry them back into the bone marrow, and develop the antibodies necessary to fight off that virus. Meanwhile, the virus is replicating. You have that 2 weeks where your strong immune system, wherever you boost or what, is building these things in the bone marrow. It takes 2 weeks to build the antibodies. Everybody keeps saying 2 weeks, and it is true. It takes 2 weeks with your strong immune system to build the antibodies, the strong antibodies you need to fight off the virus. If you're vaccinated and you have a strong immune system, you have already built strong antibodies that will fight off the disease as it gets to you immediately. Again, the difference is the 2 weeks window. You have them on board and they will fight them off. And if you're immune boost, even the stronger antibodies are right there ready because you have already built them and they're ready to fight off the disease. If you are not vaccinated, you don't have that luxury. You still have 2 weeks to wait for them strong boosted antibodies. You just, because your body is prepared with immune boosting, you still have to wait for 2 weeks to build those antibodies. And in the meantime, the virus is doing whatever he wants to do, is running havoc on your body. So the difference is the timing, 2 weeks difference. Because if you're vaccinated, the antibodies are already there, you go to work right away. That's why, Weber, you have mild symptoms or no symptoms at all. When you are vaccinated, you don't end up in the ICU, you don't end up dying because the virus doesn't have any time to multiply. 2, the virus, because it can't multiply, will not variate and it would not change. It won't form an aggressive virus because you stop it early. 3, Weber, you are not infectious. and not as infectious as someone who are not vaccinated, because the virus can't multiply, and if it can't multiply, it cannot spread the disease outside of you. And again, people always say, no, you're not infectious, you really don't spread the disease because your body's already working quickly. Remember the 2 weeks window. Your body antibodies are working very quickly, very effectively. So let's suppose you have 100 virus hit you and you are vaccinated and you have antibodies for 75 of those. You're going to knock out the 75. You might get a mild infection. In the meantime, those antibodies now are being rebuilt, but you already have memory cells, and so you're after about a few minutes or to an hour, your body don't produce another set of antibodies to take care of that other 25 virus, and so you're completely eliminated. You might have mild symptoms or no symptoms at all, or if you do get anything, you're not going to the hospital, you're not going into the ICU, it doesn't affect your lungs, and you're not going to die because you are fully vaccinated and you are prepared. You are a Boy Scout. First, be prepared, be ready, and that's where the vaccine comes in. That's your timeline. 2 weeks window is the difference between a vaccinated and an unvaccinated person, because you do not give the virus the 2 weeks to multiply. Don't care how much you immunoboost or you take your zinc and your mineral. You will get a response, but it still takes you 2 weeks to develop what is necessary, what is specific for that virus. That's how the vaccine makes it different, my people. That's simply how it makes the difference. And there are no deleterious side effects to the vaccine. 6.4 billion people have taken the vaccine. If we see any side effects, it's very minimal to none. It's very minimal to none. Ivermectin has about 90 side effects. Aspirin has about 20 side effects. Whichever one, birth control has another set of side effects. But the vaccine, if you can count 5 side effects on your hand, call me and let me know. There are very limited or not even any side effects from the vaccine.
Doc, yes,
time has proven to us that it works. We have 252 years history of vaccines that have proven to the world have worked. We cannot predict the future. There is no immune escape. There is no population control in this vaccine. We have proven that it works.
Doc, in our remaining minutes, could you address what seems to be a prevailing view that is coming up now? As you get the data, and we're learning a number of persons tested positive, and then later on you get the report that a number of persons have recovered. Some people are now holding the view that it is okay to get COVID, and then in about a week or 2 weeks, whatever, I'll recover, and that perhaps is an option against towards for taking the vaccine.
Yes, and I would say to them, if that's the chance they want to take, and lucky for them that they survive, and they might have developed some immunity, which is not long lasting. The natural immunity to the COVID disease is not very long lasting. So what I'm saying to you, you might be lucky that you don't get the long infection, and that we have known from before. This is why England was trying to do herd immunity, natural herd immunity, but they realized that a high percentage of the population are dying from the disease. And so even though you try to wait and get the disease, you are at risk for dying, number one. Number two, there is something called the long haul, or long COVID, that you get the disease, but you don't recover completely.
Right.
You end up with lung problem. You end up with all kind of a long-standing problem. If that's the chance you want to take, then that is quite appropriate. You can do that. There's the risk factor for you. And the third thing, Weber, is that what we are noticing, the humoral and the natural immunity that you develop, that some people some people still end up getting COVID a second and third time too, Weber. So they can take it get the Weber the first time, but they are still not well protected enough to get it the second and third time. The difference is, Weber, again, not only time, which I just remarked to you about, but specificity and program direction towards the virus that attacks you with your natural humoral native and indolent antibodies. What we are noticing, okay, what we are noticing is that the specific area that the virus attaches to the cell is to the S protein, and your vaccine is made specifically for that S protein, and so you develop antibodies for that, so you have a better, stronger, and more sensitive immune response to that particular. When you do your natural immunity, your body develops a more global vaccine. That is, it attacks most of the other parts of the viruses, so you don't know which one it really used to kill the virus itself, and so it's not very sensitive to that particular attachment. And the big difference between coronavirus and most of the virus we see today is that S protein. Your vaccine is more sensitive to that, and it develops antibodies to that, and it helps protect you. So with the natural immunity, we're finding that it waxes and wanes. And to one of your questions that I was you asked me about antibodies, how do you know, is that we do measure antibody titers, specific titers. So if your titer is above a certain level for that virus, we consider you to be very well immune. So we can do that. It's a little bit more involved kind of a testing, but we don't do that regularly for everybody. We only do it when we're testing the effectiveness of the vaccine. And so your titers from a natural immunity, what they're saying is not that high, and it's not that sensitive to the S protein, which is this part that is really dangerous to you, that attaches to the cell. But when you get a vaccine, because they build the vaccine towards that S protein, that is the most sensitive area, and that is more destructive to the virus than the global natural immunity that you develop. So yes, people can wait and get the disease, but you don't have that impact and that sensitivity as if you have the vaccine on board. Two, you end up with disease problems for a longer time when you get the disease and you build your natural immunity and the disease sticks around. It has a long haul because it affects your heart and everything. And we find those what we call COVID long haul, in that they have disease entity all the way down. And three, you expose yourself to that 20% number that we know will die from the COVID, affects your lungs, affects your heart. So it's not a wise thing to do, but if that's your choice, go ahead. But you don't get a good immune response as if you were vaccinated. Because we build particularly for a specific part of that virus, which is what. And that's what we're trying to prevent. Because the day, Weber, that S protein changes to a different S protein, we have to build a whole new vaccine.
Doc, we're going to leave it there, but you, in the last minute or so, you mentioned the word choice a couple of times, and one of the things that we've been debating and discussing, that I think what we do sometimes, we like to make particular choices, but do not appreciate with every choice comes a particular consequence.
Absolutely correct. Absolutely correct. Couldn't have said it better, and that's the consequences. And you need to take responsibility for those consequences. As I said, this is become a public health matter. It is the fact that we all breathe oxygen, and in the oxygen of that air is where those particles float. So we share the public space that you, who made your choices and your decision, and will have to deal with the consequences. But when your consequences, what you're dealing with, is affecting the civil liberty of the people around you, you have to have consideration. You have to make proper decision-making process. And your problem can affect each and every individual, and it becomes a public health matter. And if it's a public health matter, we have to make decisions to protect the majority, the public health of the people of this country. And that's hard decision, and that's where your politicians and them have to make these decisions, because you are impacting the livelihood of each and every individual around you. Whether when you get the disease or anybody in your office gets, you have to close down for 2 weeks. Some people can't eat or sleep. So you, by making your choice, is affecting the civil liberty and the public health of the individuals around you.
Okay, Doc, thank you very much. We held you over a bit, but we apologize for it. Until next time, Dr. Dwayne Twaithes. Doc, have a good day.
All right, thank you, man, and it's a pleasure always.
Yes, okay. All right, so that was Dr. Dwayne Twaithes once more talking on the COVID-19, the vaccine, and all that. We thank you for your input, and until next time, you all have a great day.
With all the power from the